So the procedure where I use the Argon Beam Coagulation are basically every procedure that I do. I do not start a single case if I don't have the Argon Beam all set on my table. I use the technology to achieve coagulation, and I use the technology to dissect the tissue in some specific instances. The Argon Beam is extremely effective in dissecting tissue in patients with multiple previous surgeries, where lots of scar tissue is encountered during the dissection. And I can go very carefully through this scar tissue using the Argon Beam Coagulator. Another area where it's extremely effective is when we divide the right triangular ligament of the liver, and that area can be the space that is very narrow. And using the Argon Beam Coagulator to dissect and to divide the ligament is extremely effective. So the Argon Beam Coagulator becomes essential in achieving the hemostasis on the very thin layer of tissue. And that can be used from the subcutaneous tissue and into deep down into the peritoneal structures anytime it is needed. When the Argon Beam Coagulator is used properly, it can actually speed the surgery up significantly. And a surgery that is shorter has lots of advantages. Number one, there is a shorter surgery for the patient, so there is less anesthesia time, there is less cost for the organization, faster recovery for the patient. Argon Beam Coagulation by clearing the surgical field by superficial bleeding, it facilitates the achievement of these negative margins that we are always looking to offer to our patients. What I can tell you is that hemostasis is very important in surgery. There is not just the direct cost of acquiring the unit of blood, but you have to factor in the fact that blood can cause infection or blood can cause readmission. So one single unit of blood it can be as expensive as $25,000. So when you factor in all these added potential complications, so I think that achieving and maintaining hemostasis in any surgery is extremely important, and that is why I value the usage of the Argon Beam Coagulator whenever needed.